So you've been asked to do a pain management program. This is something that's very common in terms of helping people manage chronic pain. So what are pain management programs and what do you need to know about them? Thank you once again for all the comments you've been making on all my other videos, and welcome back to this channel. And in this particular video, I'll be exploring a little bit more about what the present understanding of pain management programs are, what they are, and what you need to know, and whether that's going to be the right thing for you. So first of all, this is a very established, one of the most evidence-based ways to help people manage their chronic pain. And ultimately, this comes down to our understanding that nowadays, and for a long time, most chronic pain is due to a hypersensitive nervous and immune system. And so a lot of the techniques that are required to calm the nervous and immune system down are techniques that actually have to be learned, practiced, and reinforced repeatedly, meaning we need to embrace neuroplasticity, enhance neuroplasticity, and put in conditions that actually help neuroplasticity happen. And that's what a pain management program makes happen. So what are the elements of it? Now, this is something that is offered in the NHS, it's offered privately in the UK, and at the time of making this in 2024, there's also the option of making this kind of programs available in primary care for the first time. They are not often done in primary care, they're often available in the community, what's called intermediate care, and most often in secondary care as part of big established pain clinics in your district general hospitals in the United Kingdom. Obviously, for those of you watching in the US or in various other parts of the world, you all will have a different version of the way healthcare system in your country provides the pain management program, but the principles are broadly same. They're often run by a combination of physiotherapists, psychologists, and occupational therapists with some support from a medical consultant or a specialist pain physician. What these programs often contain is 3 core skills. The aim is to do this often in a group, because a group is going to be useful to help these 3 skills to be formed and to actually hold people accountable in some way so that these 3 skills are reinforced. So what are the 3 skills then? The first one is breathing skills, how you can control your breathing, because that makes a difference in how you can regulate your parasympathetic nervous system, the vagal system, and that can often enhance the rest and digest part of your nervous system rather than the go, go, go and the fight and flight system that often pain, chronic pain and stress holds us in. So that's the first skill, control of breathing. The second skill is to actually create a new response for your pain and move away from the old response to pain, which may often have been taking more drugs or doing less, moving less. That's not a helpful way. The new response might be a relaxation technique, might be a small activity-based technique, might be a distraction technique, what I call as the RAD technique in my book. But that is what we need to do as the second part, is to actually create a new response. And the third skill is essentially to reinforce that and to enhance neuroplasticity. All of these techniques, when you repeat them again and again. And so most pain management programs usually run for about 6 to 12 weeks. And you can imagine if you have a 1 or 2 hour program and you've got these skills to practice in between these 2 hours every week for 6 to 12 weeks, you're getting quite a number of hours of repeated habit reinforcing. And the evidence shows that on average, you need somewhere between 8 to 12 weeks of repeatedly doing something for a new circuit to form and for neuroplasticity to embed itself. And that's what pain management programs are all about. Group-based approaches which are facilitated and led by trained professionals and brings together patients with a chronic pain conditions to build these 3 skills. What's new now is that we're realizing that we need more programs, more of these kind of approaches in primary care, and that means we can do it with health coaches, we can do it with newer workforce. In the UK, for example, it's social prescribers or care coordinators, and if it is supported by an experienced professional, we can give patients the same skills much earlier, and that's what a good pain management program allows us to do. Enable us to live our life to the fullest using techniques that are evidence-based, building skills that will last us a lifetime and help us overcome pain. I hope you found this video useful. Thank you for watching, and I'll see you in the next video. Thank you for watching the videos. I hope you're getting value from them. Don't forget to subscribe and hit the bell button for notifications on when the next videos are to be released.